The Ministry of Health, Wellness and Elderly Affairs is reporting a decline in respiratory illnesses in St. Lucia during the current flu season. Dr. Harini Vemula is the Medical Surveillance Officer in the Ministry of Health.
The island is currently experiencing its annual flu season, which runs from October to March. This surge in respiratory illnesses coincides with the winter period in the Northern Hemisphere and peak visitor arrivals to the Caribbean region. The flu season is usually characterized by an increase in cases of respiratory viruses such as influenza, respiratory syncytial virus, RSV, and the COVID-19. During the last quarter of 2024, the Ministry of Health noted a rise in respiratory illnesses typical for this period, with fluctuations in reported cases throughout the weeks. Despite this, 2024 saw a 25% decrease in overall cases of respiratory illnesses, with a total of 515 cases compared to 2023.
Dr. Vemula emphasized the importance of preventative measures.
Among those tested for respiratory illnesses at the National Reference Laboratory, 23 tested positive for influenza and 58 for COVID-19. This represents an 89% and 25% decrease in these viruses respectively compared to 2023. The Ministry of Health continuously monitors trends in respiratory illnesses locally, regionally, and internationally, noting outbreaks in neighboring islands.
While cases of influenza and COVID-19 have decreased compared to the previous year, the ministry is urging the public to remain vigilant.
The public is urged to follow these guidelines from the Ministry of Health. Boost your immune system by eating a healthy diet rich in fruits and vegetables. Drink sufficient water to stay hydrated. Practice hand hygiene by washing hands frequently with soap and water. Use alcohol-based hand sanitizers when soap and water are unavailable. Avoid close contact with people who are sick. Practice cough etiquette and wear a face mask if you are sick. Regularly clean and disinfect frequently shared spaces. Get vaccinated. The influenza vaccine is available at wellness centers island-wide and is free of charge. Seek medical attention at any wellness centers, polyclinics, or from your private physician. The Ministry of Health, Wellness and Elderly Affairs will continue to monitor the situation and provide frequent updates to the public.
The ministry continues to monitor the situation closely and encourages residents to seek medical attention promptly if experiencing any respiratory symptoms. Joachim Duplessis, HTS News Force.